Hello, this is Clinical Reflection number 5, and today I'm going to talk about a 56-year-old female who was admitted to us, but she was a transfer patient. She came from the Riverside location, so she came over to see our urologist. Her reason for visiting was she had uterine stones, and this isn't her first time. It's according to her history, she has prior kidney stones as well, but this time it's much worse. She does have a history of hypertension. Um, Something I found interesting was her being allergic to strawberries. That was my first time hearing someone allergic to that. Um, However, the way things started was she had pain in her abdomen. She developed flank pain on the left side as she was out at a party. She says that usually there is minor pain there, but due to the prior history of having kidney stones, and since it wasn't much of a big deal that first time, she didn't pay much attention to it. However, the pain continued, and that's what led her to be admitted to the hospital. So she came over to see our urologist. When she saw the urologist, the orders were to continuously strain her urine. Um, so she hasn't had much urine output. She did have to get a catheter in place when she was at the Riverside location, but as she was admitted over to us, it was no longer in order to have that in. So she was getting small urinary output, but it was still some flowing to where she didn't have to get a catheter in place again. So that was something new for me. I never knew what, how we strain urine. So to see that, it was interesting. In the bathroom, we got like a one of those hat cups that you place on the toilet, and then the strainer. It looks like a bucket, but at the very bottom of it, you'll see where the urine is getting strained, so we can catch whatever stones may be there. So after she'd urinate, she would let us know. That's when we would go into the room and continue to strain the urine. So that was a good learning experience for me. So now that I know if there's possible kidney stones or stones present in anyone's body, a possible order could be to strain the urine. This patient did end up having to get a procedure done to remove the stones or just shatter it. So it's not causing any more pain or blockage there. So she did have to go through that, but she was feeling much better after the procedure was done. So for her, it was most likely managing any um, post-operation pain that she may be having and just comforting measures for her until she's discharged to go home. Something else that was interesting that happened that day was I was able to get practice on inserting an IV. So this was an older patient. She was about 80 years old. She was very nice and sweet. She needed to get a new IV inserted due to her old one just getting occluded and no longer working properly when they tried to flush it. So I had the opportunity to try that on here. I was able to get flash, so blood flash that came when I inserted the catheter. However, um, the blood was not flowing all the way through. So we did have to try that again on her, but I let my nurse do that second try. But I was just excited that I was able to get the opportunity again to continue to build practice and strengthening in that area that's needed. I'm happy that I was able to get a flash of blood, so that lets me know I was in the right location. Just needed to maybe do some minor fixing to it. But that was a great opportunity and practice for me. So, a key takeaway from today would be just to, whenever there is an opportunity to grow and learn, always pursue the opportunity and take it. So, for instance, the IV practice, I didn't know that we would be getting another IV so late. It was very late, but turns out someone needed one. So, I was able to volunteer to do that. In any moment or any chance I get to do something new, I should take that because that's only going to help me for the better and strengthen my skills so that when it is time for me to be a professional nurse with my license, I'll be able to already have practice in that area and just continue to do great from there.